Hi, my name is Heidi Nikiforuk, and I'll be doing a video presentation for BCIT's course NSPN 7155, The Breastfeeding Experience. I'll be discussing the topic of decreased milk supply with a hypoglycemic newborn. I'll be discussing this topic within the model of the Situated Clinical Decision-Making Framework, which was learned in the BCIT course, Module 4A. The situated clinical decision-making framework involves several components, such as knowledge, cues, judgment, decisions, and evaluation of outcomes. We will further explore these throughout this presentation. First, knowledge. What do we know about a case, or in this case, the breastfeeding challenge of decreased milk supply with a hypoglycemic newborn? What we do know are certain risk factors for decreased milk supply. The main one would be that if baby is not breastfeeding effectively and or frequently, then of course mom will experience decreased milk supply. Others include previous breast surgery, insufficient glandular tissue, no breast changes during pregnancy, use of bottles, nipple shields, or pacifiers, which could lead to nipple confusion, supplementation with formula, offering only one breast per feed before milk is established, hypothyroidism, anemia, smoking, and certain medications. What we do know is that milk is the main source of energy for infants. While baby is in utero, baby receives glucose via umbilical cord from mom. The baby stores glucose in the form of glycogen in his liver and some muscles. After baby is born and the umbilical cord is cut, he no longer receives glucose from mom and must depend on his own stores and receive glucose through feeds. In a healthy term infant, blood sugar levels are usually at their lowest at about 1 to 2 hours after birth, and then usually starts to increase within 2 to 4 hours and continue to rise for the first 96 hours after birth. Infant risk factors for development of newborn hypoglycemia include large for gestational age, over 4,000 grams, small for gestational age, under 2,500 grams, prematurity, cold stress hypothermia, respiratory distress, post-asphyxia, endocrine abnormalities, delayed first feeding, and separation of baby and mom as skin-to-skin contact helps to stabilize blood glucose levels. The maternal risk factors for newborn hypoglycemia include maternal diabetes, maternal weight gain, smoking, gravidity, parity, hypertension, lack of maternal oral intake, and maternal medications that affect glucose status, for example, tocolytics. Next, we'll discuss cues, the typical signs, symptoms, lab data, or assessment data. When assessing milk production, it can be difficult. There are no set standards for milk production. Everybody is unique and individualized. The best way to assess milk production is actually to assess the infant. We could do this through assessment of weight gain, usually 1 ounce daily for the first 3 months, returning to birth weight by 2 weeks of age. Observing the stool changes, usually from green-brown meconium to mustard yellow by about the 5th day postpartum. 6 to 7 voids daily. Infant feeding approximately every 2 to 3 hours. When infant is breastfeeding, audible swallowing should be noted during these feeds, and if baby is active and appears healthy, of course. The clinical signs of a hypoglycemia in the term infant include abnormal level of consciousness, irritability, lethargic, abnormal vital signs, tachypnea, abnormal tone, tremor, seizures, poor sucking, diaphoresis, and hypothermia. There are medical tests for the newborn with hypoglycemia. If the infant is already identified at birth as having risk factors, which the risk factors were identified earlier in the presentation, then they should have a blood glucose test approximately 2 hours of age. This is usually done through a heel stick prick. Other tests would include a glucose in the newborn metabolic disorder screening test and perhaps a urine test. If the infant is asymptomatic and the glucose reading is under 2.6 millimoles per liter, then treat by feeding the baby first, preferably breast milk. Repeat glucose levels within 1 hour. When an infant is showing signs and symptoms of hypoglycemia, then check blood glucose levels right away. Feed baby, preferably breast milk again, and then repeat glucose tests after 30 minutes. Next is the judgment, looking at the case itself, what could be going on, looking at if we would be consulting with anyone else, and looking at priorities for this case. Looking at what could happen. The baby may not be effectively and efficiently breastfeeding, and therefore mom is experiencing decreased milk supply. And if the baby is not getting enough milk, to increase their blood glucose levels. At this time, I would consult with a lactation consultant to help this mom to effectively and efficiently breastfeed in order to increase her milk supply and to make sure that baby is getting the glucose that they need. I would also consult with bringing a pediatrician who would help to monitor and assess this baby and get this baby the treatment that it needs. I would also look at consulting with family and friends of this mom, perhaps for emotional support and encouragement at this time. The three main priorities that I have identified are to maintain increased milk supply through effective breastfeeding and/or pumping. To monitor, assess, and treat the infant, we would like to achieve and maintain healthy blood glucose levels for this infant. Next, we like to overall support and encourage the mom and baby to stay together as much as possible, skin to skin, and more frequently breastfeed, both of which will increase milk supply and to help stabilize the infant's blood glucose levels. Next is decisions, treatments. Treatment for decreased milk supply. The main one would be to breastfeed the baby frequently and effectively. We would want to keep the baby skin to skin as much as possible in order to increase milk supply. If baby is unable to breastfeed, then hand expression and the use of breast pumps to stimulate the breast until baby is able to breastfeed again. Improve breastfeeding latch if needed. Encourage and support this mom through this difficult challenge. We would also look at pumping after breastfeeding the baby in order to stimulate more milk production. The treatment for newborn hypoglycemia would, again, the first step would be to frequently and effectively breastfeed this baby. If baby is unable to effectively breastfeed, then feeding baby with express breast milk via cup or finger tube feeding. If no express breast milk is available, then consider donated pasteurized breast milk or breast milk substitute. In extreme cases, IV glucose may be administered if blood glucose levels are extremely low. The final step would be evaluating the outcome. We would want to evaluate, was the mom able to increase and maintain her milk supply? We would be able to evaluate this through assessing the infant's gaining a weight. If there's now audible swallowing when the infant's breastfeeding, is baby active and healthy? Is there 6 to 7 wet diapers a day? Stools changing color from green, brown to mustard yellow? Was the baby able to achieve and maintain a healthy glucose level? We would like to discuss and explore with the mom and family if they felt supported during this experience. When dealing with this particular breastfeeding challenge of decreased milk production and with a hypoglycemic newborn, the main goals are to support frequent and effective breastfeeding while monitoring the infant's blood glucose levels. Also, support and encouragement of the mother can go a long way when working together for common goals such as increasing milk supply and having a healthy infant. I hope you enjoy the presentation and learn from it. Thanks.